Hmm. Okay. What's going on, Maleeha? What's happening? Like, what's going on?
What does that sound like to you? Okay.
It sounds like really bad snoring,
Yes.
like what my
Pic
husband does.
okay, picture this. Your partner, like you just said,
Mm-hmm.
says, you snore, like really snore. And you wake up tired every single day and you blame it on work or family issues, getting older, poor sleep hygiene. But what if I told you something is literally stopping you from breathing dozens of times every night?
Yeah. And here's the scary part. When you don't breathe for spells during the night, night after night, you could be slowly damaging your heart and brain and have absolutely no idea.
Yeah, this isn't just some simple snoring, guys. This is called sleep apnea. And 80% of people with sleep apnea don't know they even have it. 80%.
80%. That is
Mhm.
such a high number, Maleeha.
Yep.
And I didn't realize that until we started looking into this episode that high percentage of people are undiagnosed because we talk about snoring all the time in our profession.
Mhm.
And to make matters worse, wellness culture on social media is trying to sell you mouth tape and sleep hacks to fix your exhaustion.
Mm-mm.
These trendy fixes, they can actually be really dangerous. And especially if you have undiagnosed sleep apnea.
For sure. And as airway docs, you and me, this is total rage bait for me, like amongst many things, but this is one of them. So, everybody out there, we want you to protect your brains. Today, we're going to be breaking down what sleep apnea really is, why it's so underdiagnosed, and what you actually need to do about it. This could genuinely be the best thing you do for your health this year in 2026.
Remember, we're two doctors who don't want you to be duped by fake health gurus. So let's dive in. And by the way, hope you've noticed our sleep attire because we're really into this episode.
Yeah.
We're in our PJs today.
And then I just realized, like, I have a serious plant theme going on. Like, my
I see that.
pajamas are
I
plants.
see.
I got a monster. I know. It's a
It's a
whole thing.
tranquil environment
It's totally
for
peaceful
for
because I'm trying to
bedtime.
oxygenate.
That's right. That's
Okay,
right.
so tie in. All right. So let's start with the basics. What is sleep apnea? Dion.
So, it's a common disorder where you literally stop breathing for small stretches of time during your sleep. This
Mhm.
happens because your upper airways collapse repeatedly throughout the night. For a lot of people, this happens many times throughout the night.
Yeah, and here's why people don't realize they have it, because it's happening while you're asleep, right? You're not conscious of it. So you wake up exhausted and blame it on 100 other things.
Yeah, yeah. And you might think, oh, I'm just stressed or I'm getting older or I have kids. But meanwhile, your brain is panicking multiple times per night because you've stopped breathing.
Yeah.
Yeah.
And worst part is it's progressive. So often it starts off really mild. Maybe you're snoring just a little bit. You're feeling a little bit more tired than usual. But over time, especially as you age or gain weight or both, it gets
Mm-hmm.
worse.
Yeah, when you sleep, all the tissues in your airways relax and collapse. So now you have limited air flowing through your airways, and your oxygen starts to drop and it gets more severe. And
Mhm.
suddenly you're dealing with some serious health consequences. When the oxygen levels in your body drop night after night, this puts a lot of stress on the body and it starts to work overtime to deal with it, leading to dangerous problems.
Yeah, I mean, it's literally described by my patients as if they're waking up gasping for air.
That's
Like
right.
the brain is panicking and telling you to wake up and breathe. So yeah. Okay, so now we got to talk about why this actually matters if you haven't already picked up on this that it matters. Because I think a lot of people hear sleep apnea and they think I'm just tired. Like it's just the whole thing is about being tired. And they think of the sleep part of the equation, but they're not hearing the apnea part, okay? And the apnea is actually the key part. Apnea means no breathing. which means no oxygen. So it's much more serious than you might think. I mean, it's as basic as that. No breathing, no oxygen.
So this is serious. But let's start with the day-to-day stuff. If you don't sleep well at night, you're naturally going to have impaired daytime focus, difficulty with social interactions, falling asleep during routine activities. Have you been there before? Not good, right?
Yeah, not good. Cognitive issues, memory problems. You even have a higher risk of dementia down the road. So,
Yeah.
all of this is strongly connected to sleep quality. Imagine trying to work, take care of your family, or just function, and your brain is essentially sleep deprived every single day. So, that's the stuff that happens to everyone who chronically doesn't get proper sleep. Obstructive sleep apnea or not, sleep deprivation
Yeah.
causes all of these problems.
Yeah. Yeah. And then there's the really dangerous stuff, right? Like falling asleep while driving.
Of
That's
course.
pretty terrible. We don't want
Yeah,
that.
that's terrifying. But then let's talk about the long-term health consequences, and
Mhm.
that's where we're really concerned because it gets scarier. We're talking about heart disease, hypertension, strokes, atrial fibrillation, heart failure, coronary artery disease. These are all big things. So, why is that?
Yeah. So, sleep apnea has some serious effects on your heart, which is responsible for pumping blood to your body. It's carrying oxygen to all of the organs, and oxygen is its fuel. So, when you're not getting oxygen, the heart has less fuel to do its job, and that puts stress on your cardiovascular system. The lungs are also strained because low oxygen can cause inflammation, collapsed airways. It can worsen underlying lung diseases like COPD and asthma, and it can lead to a condition called pulmonary hypertension. Not our favorite thing to see as
Yeah,
anesthesia.
no.
Not our favorite
That's
thing.
like that word makes me
Yeah.
sneeze. Like, oh,
Yes, exactly.
yeah,
Yeah.
yeah.
So pulmonary hypertension can have severe consequences on the heart, leading to something that called right heart failure or failure to the right-sided chambers of the heart. It's difficult to treat, and as you saw by Maleeha's reaction, our sphincters get tight when we see patients like that in the OR.
They do.
Not a fun one. So needless to say, the two vital organs can be severely affected by sleep apnea. This is why it's so important to be treated by a specialist.
Very important. Ugh, I'm, like, still shuddering from the pulmonary hypertension and the right heart failure because those things are always combined with a bad picture.
Yes.
And they're just tricky for us to manage under anesthesia. But
Yeah.
did you know also chronic heartburn is something that is closely linked to obstructive apnea?
Yes.
And the way I want you to think about this is when your airway is obstructed, there's like increased pressure in your stomach, in your thoracic cavity, and it can cause the stomach acid to reflux up the esophagus, causing that burning sensation at night, specifically because you're lying flat. Okay.
Mhm.
And so
Mhm.
that the pH acidic acid is very, very irritating to people. But the good news is they can be fixed. So if you have chronic heartburn and you're going to your gastroenterologist to have it looked up or your primary care doctor, they should be evaluating you of obstructive sleep apnea as well if you kind of fit the criteria because those two things often go together for a lot of people.
Yeah. And as someone who, deals with heartburn, you know,
Yeah,
it's good to know that sleep apnea might be contributing so you can kind of kill two birds with one stone. So this is a good point that
absolutely.
you just made.
Yeah.
There's also a strong link between sleep apnea and metabolic syndrome and type 2 diabetes. These are
Mhm.
big buzzwords if you're not living under a rock and you're on social media. There's always talk about metabolic disease,
Yeah.
and people don't realize how sleep apnea can play a role in that. Again, sleep apnea can cause inflammation in the body, and that can lead to insulin resistance or diabetes. The lack of oxygen may increase your sympathetic drive. Basically, your adrenaline's up, which can lead to high blood pressure. Cholesterol. People tend to have higher cholesterol when they have sleep apnea. And abdominal fat and obesity. So all of these are components of metabolic syndrome, and all of these are related to sleep apnea.
Yeah, and again, this is a hard topic because there's so many different components and they're all interrelated, right? There is an
Mhm.
inflammatory component that's not a good one, like you mentioned. Sympathetic drive, which is your fight or flight system, your cortisol levels are high. So,
Yeah.
I mean, this is the thing with a lot of medicine. There's a lot of nuance here. There's not a one single answer. And a lot of this stuff is related. And that's why you have syndrome, metabolic syndrome, meaning it's
Right.
this whole big picture that we're looking at. So I know that was a lot, but thank you, Dion, because
Yeah,
it's
that's
important to
a
understand there's a lot in that bucket. Even if you're young, like especially for women of childbearing age, having untreated sleep apnea can actually worsen during pregnancy and
Mhm.
potentially cause real harm to the baby. So if you think about it, if you have chronic low levels of oxygen in mom, right? And that gets worse because, you're bigger as you progress with
Right.
pregnancy. Your lungs are being pushed up by the baby. It's getting harder and harder to breathe. I know this feeling. We all know this feeling, right?
Mhm.
But
Yeah.
if you're not sleeping well and you're not oxygenating well, and if it's severe enough, that also means the fetus isn't getting the amount of oxygen that they need to grow and develop properly. And that can be actually quite dangerous if it's severe.
Yeah.
So, obstructive sleep apnea isn't just about feeling groggy. I want you to think about the cardiovascular health aspect to this,
Mhm.
all right? Your metabolic health, your brain health, potentially your baby's health, everything,
Yeah.
you
Yeah.
know?
Yeah.
I almost wish the name was called apnea sleep, like, or something instead of sleep apnea, because the apnea is the scarier part of that phrase.
Yeah, I agree with you. I think it needs some rebranding so people can get the gravity of what sleep apnea is, because so
Right.
many people shrug it off when we see our patients. They just like, yeah, I might.
Or it's
Yeah,
like
I've
their
been
partner,
told.
like, he snores,
Yeah,
she
no big
snores.
deal.
Yeah, and I'm like, you might
It's
wanna get
actually
that.
kind of a big deal. Yeah.
Right, because they'll answer to the other questions like, "Do you have
Yeah.
heartburn reflux?" Check, yes.
Yeah.
"Do you have hypertension?" Check, yes. Like, okay, like, these things are I know you don't see it, but when I
Related.
see it, I'm like, "These are all related," okay?
Yeah.
And if you fix some things, everything else will go down with it.
That's right. That's
Yeah.
right.
So, like, if it's that serious, as in 80% of cases are undiagnosed, the question is like, why? Like, we talked about it a little bit, but why are so many people walking around with this condition and just not knowing about it?
The 80% number is still so wild to me. I believe
Yeah.
it though, because again, when we're interacting with our patients, we ask that question. And again, it's that shrugging. But I think that's a really great question that you just asked. And
Yeah.
I think part of it is that the symptoms seem normal.
Mhm.
Like you said, your partner notices that you snore, but a lot of people snore and people don't think it's a big deal.
Mhm.
People snore as they get older. They don't necessarily connect snoring with a medical problem. You're
Right.
pregnant, there's so much is going on when you're
Right.
pregnant. Oh my gosh. So if you
Yeah.
snore, it's just like
Another thing.
another
Right.
thing that you're dealing with. So I think that's a big reason why that number is so high, that 80% is, of
Exactly,
undiagnosed
and I
people.
wanna
Yeah.
say, like, it's not like snoring is just one thing. I mean, it's not like everybody who
Right.
snores has sleep apnea, I'm not trying to say that, but, it's something that it can be a clue, right? You were playing detective here.
Mhm.
It's a little bit of a clue,
Mhm.
right?
Mhm. Yeah. Um, and if you're one of the other things that you may notice is being exhausted all the time.
Mhm.
And people dismiss that, right? We live in a stressful world, and
Right.
they'll just say it's that stress of life.
Yeah, you're just gonna be like,
Mm,
"I'm just really tired lately,"
exactly.
but you're not
Exactly.
actually sleeping.
Right. Or oxygenating. Yeah. So there's also this trend too of sleep divorce,
Yes.
which is a new term that I learned when we were, researching for this episode, but it makes sense because I'm almost sleep divorced from my husband, to be honest.
Mm.
Couples sleep in separate rooms because of the snoring, and I get it because it's so disruptive. And when I used to take call, I mean, was hard for me to be in the same room. So that's something that may make us miss a diagnosis of sleep apnea because your partner's literally not there to notice how often you're not breathing during the night
Yeah,
and
I mean, I
masking
think
serious issues.
if you're not sleeping with someone because they snore really heavily, if you still have feelings for them, I think you need to tell them because and book a doctor's appointment.
What a doctor's appointment. That's
Yeah.
right.
I
And I did,
mean,
by the way, but so many people don't. They just go to
oh,
a different room.
yes. Yes, absolutely. I mean, I'm guilty of the occasional slight jaw thrust if I feel like
My
if
gosh.
I feel like
Jaw thrust,
there's a
move them
little
to the
apnea
side.
happening. It's, repositioning on the lateral side
Yes.
and, a slight jaw thrust, and I'm like, "Oh, no." Like,
There's a
that's
little kicking too. I'm like, "Wake up, boy. Just wait. You're affecting my sleep." Anything to make
uh,
him breathe, I
yeah,
swear.
it's love. It's a different kind of love. It doesn't
Exactly.
feel
Tough love.
loving. I don't think it's
Tough
the
love.
kind of touch they're looking for in the
No, not the gentle touch. No, no,
No,
no, no, no.
no. It's the saving kind of
That's right. We're saving lives.
We
We're
are.
oxygenating his organs.
Yes. And here's something that people don't realize. You can have sleep apnea even if you're not obese, okay? I will say weight is definitely a major risk factor and you'll see this. A lot of the people who have lost a substantial amount of weight on GLP-1s, their sleep apnea has gone away with it, okay?
Yeah,
And notice this is a great example when I was talking about the syndromic effect. We were talking about the metabolic syndrome earlier. So
right?
the GLP-1s, what are they doing? They're reducing so much of the inflammation. They're reducing
That's
weight.
right.
That's why you're seeing improvements in sleep. You're seeing people coming off their antihypertensive. You're seeing people who were diabetic having excellent blood sugar control,
A1Cs.
right? So
Mhm.
again, it's like that whole picture syndrome sort of a lot of things are getting improved because of the lowered amount of inflammation and weight. But
Yeah,
having said that, thin people can have obstructive sleep apnea as well,
that's right.
and especially, and you might be wondering why, it's because they can have certain anatomical features that narrow their airway. And
Mhm.
so you're thinking, somebody might have nasal polyps in their nose.
Mhm.
They might have a
Mhm.
very narrow palate or a really large tongue. And all of
Yeah.
those things obstruct the airways. And it's not because of necessarily extra soft tissue like a real thick neck or, you know, a double sort of chin that's hard
Yeah.
to.
And you can have that even as like a slim person, you can have a thick neck,
Yes.
double chin. The other
Yes.
thing is tonsils, enlarged tonsils,
Yes.
which we see
Adenoids, tonsil.
all
Yep.
the time. Yes,
Hmm.
exactly.
And you see that in little kids a lot, right?
That's right.
We've got
That's
little
right.
kids, we're
It's
doing
one of the main
tonsils and adenoids, and it's because at night, they're, like, gasping for
that's
air.
right.
We're having recurrent infections, and it's important to catch it in kids because it affects their development of their face.
Right. And just
Absolutely.
development period, because
Yes, you're
again,
right.
oxygenation, that's what
Absolutely. Like, their
yeah.
cognitive development, all of the things, but also, like, the actual development of their bone
That's
structure.
right. That's right.
Yes.
So basically, don't dismiss the possibility of having sleep apnea just because you're not overweight. Okay. You could still have sleep apnea.
Absolutely,
So,
and that was a good we're not really talking about pediatrics here, like kids,
mm-hmm,
because
mm-hmm.
I do think parents are a little bit more vigilant when it comes to kids snoring because it feels abnormal.
That's
Like, when you
right.
hear a kid snoring, you're like, "Kids aren't supposed to really be snoring every single night." But neither are adults. So, you really shouldn't be snoring all the time.
Right.
Um,
Right.
okay, so let's talk about the elephant in the room, or should I say, the mouth tape on the face. Have you seen
Girl,
that?
let's talk about it. Let's talk about it.
Yeah.
Oh man. So we kind of touched on this on the last episode, this dangerous biohack that wellness people kind of push. And it's trending right now. And it could be masking life threatening conditions. And that's mouth taping.
Mhm. Mouth taping, it's all over TikTok and Instagram, and the idea is that taping your mouth shut at night forces you to breathe through your nose, which supposedly improves your sleep quality.
Yeah, supposedly. But here's the problem. If you have sleep apnea, this can be incredibly dangerous. Not a good
Okay,
idea.
I'm honestly trying to picture that. If somebody was like, "Put some tape on your mouth," I would be like, "Mm-mm, mm-mm." Yeah, like,
It's a no for me.
what
It's a no
other
for me.
that would cause me so much anxiety. I'd be like, "What is happening?" Especially okay, so the question is why do you have obstructive sleep apnea, right?
Mhm.
So if you have
Mhm.
anatomical obstructions, right, or that prevent you from breathing through your nose well, like a
Mhm.
stuffy nose, allergies, a deviated septum, nasal issues. The last thing you want to do is tape your mouth shut so that you can further restrict your airflow. Like that makes no sense.
Exactly. You're essentially blocking off your backup breathing route,
Mhm.
and in severe cases, this can lead to asphyxiation. Why
Asphyxiation
am I struggling with that word?
because it's a weird word. Yeah.
Yeah,
Yeah.
but you get the point,
I
people.
got
You
you.
get the
I
point.
got you.
You get the point.
And so here's the deal. The evidence for mouth taping, does it actually work? Is there any evidence? Like lately, the question is, does anybody even care if there's evidence? That's another thing. Okay. But
Right,
I
right.
digress. In small studies, like I'm talking about like 30 people. Okay. It's been
Mhm.
shown to have some a decent adjunct for people with mild sleep apnea. But we're talking about very small studies, like
Right,
20, 30 people, like I said before. It hasn't
right,
been evaluated over a lot of people, and again, that's with people who already have the diagnosis of having mild sleep apnea, okay?
right.
It's not indicated to be used alone, or nor
Never.
does it work for all sleep apnea. So, pretty much the evidence isn't there to support using it, as in put it in your cart from Instagram and just buy it. Usually the people who are talking about this, they have the product they're trying to sell you,
That's right.
okay?
Yeah.
So that should be the red flag right there.
Right. And like you said, like if you have severe sleep apnea, don't even think about taping your mouth. That
Yeah.
is very, very dangerous. Then there's all the sleep maxing hacks. Okay.
Mhm.
I mean, we just come up with new things every day. It's so crazy. It's these elaborate routines and products that promise better sleep. And, although some of the tips are just good basic hygiene that are evidence based,
Mhm.
many of them, like weighted blankets, mouth taping, again,
Mhm.
thumbs down, daily melatonin. These are not backed by evidence. And most importantly, it doesn't get to the root cause of the sleep apnea. And if you're not addressing the root cause, you're not fixing the problem. These hacks will not fix the problem. They're just a band aid. Okay. And you're still going to have the underlying, consequences of sleep apnea because you're not fixing the problem.
Right. I mean, I think we talked about this before. I call it the sprinkles on the cake. Like, not
Yes.
the mouth tape, but like the weighted blanket. There are tips to
Mm-hmm.
have better sleep, like cooling the room down, taking all your devices out of the room. Like,
Right.
everybody's going to benefit from these things. Okay.
Right. Right.
So we're not dismissing the marginal help these things provide. But if you're having severe snoring and you're having other issues, then you need to see a doctor first before
Right.
doing all the other things.
Right. Because we all need good sleep hygiene, but if you have sleep
Correct.
apnea,
Yeah,
you need way more than that.
exactly.
You
That's
need way
more than
more
a
than
weighted
that.
blankets can handle. Okay. Okay. But that's
Duh. Oh my gosh.
but
Facts. I'm
again,
sorry.
yeah. But that's why I'm so passionate about this topic,
Yeah.
because it's not even the topic. It's that social media makes you think that you can just
Yeah. It's a quick
DIY
fix.
yourself to better
Mm-hmm.
sleep and curing sleep
Mm-hmm.
apnea. And some things require real diagnosis, a real medical treatment. There's nuance, there's complexity.
Right.
Dionne and I are not trying to sell you anything. We're just trying to educate.
That's right.
Yeah.
And you might have symptoms or even suspect that you have sleep apnea, but you need to figure out why in order to treat it effectively.
Right.
Not everything works for everybody. This is something we say all the time. It's not a one size fit all. And
Right.
that's why you need to see an expert. Okay.
Sure.
Go to your doctor to get the proper diagnosis and treatment.
Absolutely. So let's help people figure out if they should get tested. Okay.
Yeah.
So, as an anesthesiologist, I ask all my patients if they have sleep apnea before surgery. And a lot of people have no idea what I'm even talking about, right?
Yeah.
Usually I can diagnose it just on sight, right? So, let's talk. They're like, do I? I'm like, you do.
Definitely.
Yeah.
Yeah.
So let's talk about the common signs. We have like a really good questionnaire that a lot of people use.
Yeah.
Let's
The
break that
stop
one down.
bang, stop
Stop
bang.
bang.
Yeah.
Yeah.
So, like Malia said, as anesthesiologist, sleep apnea is important to us. So we use this quick and dirty, questionnaire to kind of, it will let us know that you have a high probability of having sleep apnea. So the S is snoring. Do you snore loudly? T is tired. Do you often feel tired or fatigued or sleepy during the day?
Mhm.
Oh, is it observed? Has your partner observed you stop breathing at night? P is pressure. Do you have high blood pressure? We talked about that association. B is high BMI. So a BMI over 35 will increase your risk. A is age over 50. N is your neck circumference. For men, it's over 17 inches. For women, it's 15. And then G is for gender. Men, you guys win this round. You guys are higher
You
risk.
can take it. Yeah, high risk
You can
men.
take that one. You
Take
can
that
take
one.
it.
Yeah, and so, like, for every yes you have in that questionnaire, you get 1 point, okay?
Yeah.
And so if you add up your points and you have a high score, well, then that's a sign to talk to a sleep specialist or your doctor. And so this is, like, a super quick screening tool, like, you can do it just right now as we talk through it. It takes literally a minute.
Yeah.
So, we can post that on Instagram or on our notes so you can take the quiz for yourself at home or you can Google it. Everybody uses this in the healthcare industry. It's called Stop Bang because it's easy to remember.
That's right. That's right. And speaking of specialists, if you think you might have sleep apnea, especially if you're a critical worker, like a
Mhm.
pilot, driver, police officer, nurse, or physician,
Yeah.
anywhere where falling asleep on the job could literally cost lives,
Mhm.
you really need to get a sleep study.
Mhm.
Okay. This is not a recommendation. This is a requirement. Go ahead and do
Yeah.
that.
Absolutely, because a
Thanks.
sleep study is the golden standard of
Hmm.
diagnosis, and you can do it in a lab where they monitor you overnight.
Home sleep studies.
Yeah.
Yeah, so this makes sleep studies more accessible, right? More
Mhm.
available. It's great for people with limited access to specialists and also limited transportation. Any type of constraint, anything is easier done at home and
Mhm.
it'll make people more compliant and willing to do it.
Yeah. And, here's something cool too. Like, if you sleep by yourself, so like nobody's observing you snore, you can use wearable tech like an Apple Watch now can detect early signs of sleep apnea. So, the tech, this is an example where I think it can be helpful to have wearable tech. Like, if you're concerned that you might have this or you want to track your sleep because you're trying to understand why you're feeling so tired and you don't remember, this is where the technology is making the diagnosis a little bit easier. It may. I'm still not a big fan of wearing the tech every single night because I do know that they like to collect the data and hold on to it.
Yeah.
And
Yeah.
I'm not a big fan of that part of it, but if you're just trying to get a diagnosis and track yourself, that's honestly it's kind of hard not to.
Yeah. It's
Yeah,
not bad. Not bad at all. But remember, guys, these devices are screening tools. They're not a replacement for an actual medical diagnosis. Okay.
absolutely.
Yeah.
Absolutely.
So let's talk about treatment options.
So let's say you got a high score and now you've been diagnosed. So
Hmm.
so what now? Let's talk about the treatment options. Now, depending on how severe your sleep apnea is, because there's a ranking system of how severe, like mild, moderate, severe, the treatment's gonna match that, right?
Right.
And so it could be as simple as the lifestyle modifications, right? That are involved. They're just way less involved than machines or having surgery. Okay.
Right.
If you have more severe sleep apnea, the CPAP machine is the gold standard still. And CPAP stands for continuous positive airway pressure. So basically, it's a mask you wear over your mouth and nose, this area, at night, and it keeps your airway open with pressurized air. Actually, does it do mouth? It might just do nose now, too. I
You
don't know if
can
it.
do, yeah, there's both.
Yeah.
Yeah, there's the nose and there's the full on mask. I mean, I have personal experience with it via my husband because he's
Oh,
had
I
to
didn't
use the
know that.
CPAP machine. Yeah, yeah, yeah. He's had to use it. Compliance is tough. And
Mhm.
I know, Maleeha, when you're talking to your patients, we do find the patient who says, yeah, I was diagnosed. I used to use a CPAP, but I hated it, so I stopped
Mhm.
using it. I hear that all the time. It's not
Absolutely.
the most comfortable, but on the flip side, for those who are compliant with it, it can be life-changing, actually. People feel more refreshed and energetic, get better sleep at night. It really
Mhm.
is the gold standard treatment. I know you have some personal experience
I
with it
do,
too,
I do.
right?
So my dad uses a CPAP machine, and
Mhm.
it's been a total game changer
Yeah,
for him. And I definitely feel like the design has improved significantly since we were in training because
yeah.
nobody used to wear it. It was like, in Batman, what was that character with the mask?
Don't
The
ask me.
respirator.
You don't
Okay.
want me on your cultural trivia. No. I would
Okay.
I would suck.
I'm just saying, I mean, it was insane.
Pop
Okay.
culture, that's what I meant to
Yeah,
say.
pop culture. It was an insane mess. So now it's improved a lot. My dad definitely uses it. It packages really nice in a case that's just like this big because he takes it with him when he has to travel. But it's been
Mhm.
a game changer. Like he sleeps very well through the night. He notices that he wakes up a lot more refreshed. So, how sometimes you see older people and they just are drifting off in the middle of the afternoon on the sofa,
Yeah.
like they just drift. That doesn't happen anymore for him.
Oh,
So that's a
good,
positive. Yeah, that's
good.
a good thing.
Yeah. Yeah. Well, how does your mom feel sleeping next to him? Because the machine can be a little loud. I can
It
tell you
is. So
that from
I don't think she
experience.
loves it, but
Yeah.
she is definitely happier that he's healthier. And I think it lets her watch like late night TV shows.
Oh,
You
that's
know what I mean?
good.
Like she'll
Yeah,
watch these
yeah,
late night shows without feeling like she's bothering him because she's like, you know what? He's out of it. He's got this loud
yeah.
machine on.
I'm doing less jaw thrusts and,
There,
moving him to the side. So
exactly.
it's been a game changer for us.
There you go.
So, yeah, it's a winner. But, like we said, not everyone can tolerate it. So sometimes we need alternatives. And so one thing that some people use is an oral appliance. And these
Mhm.
are evidence-based and FDA approved. They work by shifting your jaw
Mhm.
forward, and that helps open the airway. It's kind of like a mouth guard. You wear it at night. People tend to tolerate this more than CPAP, but it doesn't work on everyone. Okay. So, again, you would need a doctor to guide that treatment and tell you if you even qualify, if that would even work for you. But it is another option.
Yeah, that's a good one. I also had
Yeah.
a patient that I learned about this. It's radio frequency ablation or
Mm,
RFA. It's minimally invasive office procedure. So it uses targeted radio frequency energy to shrink excess tissue in the throat, like the tongue, the base, the soft palate, the nasal turbinates. And the idea is that it opens up the airway and reduces snoring. But again, this is for mild to moderate sleep apnea. It's quick, it's done in
mhm.
the office, and it definitely has less pain and downtime as compared to a traditional surgery.
Yeah. Yeah. There's also the hypoglossal nerve stimulator. The brand name is Inspire. So some people may have heard of that. I've had a lot of patients have success with this device. It's implanted and stimulates the nerve that controls your tongue,
Mhm.
keeping your airway open. So that's another option for people.
Yeah, for sure. Here's something brand new. The FDA just approved GLP-1 medications for sleep apnea. You know, drugs like the Ozempic and the Wegovy. It's like the
Mhm.
GLP-1s are actually solving a lot of life's problems for us.
Yeah, I
Yeah.
mean, there are definitely a lot of benefits to GLP-1s. I mean, we talk about a lot of the risks, but there are some benefits when it's used the right way. And, this makes sense that GLP-1s would help with sleep apnea because there's a strong correlation between sleep apnea and, being obese. So if we can decrease your weight, we can decrease the sleep apnea. So I can see why the GLP-1s are used in this arena.
Absolutely. And those are all lifestyle changes, the weight loss, changing your
Mhm.
sleep position, going side sleeping, avoiding alcohol and sedatives for before bed. All of those things can help, especially for the mild cases, right?
Right, right. The key is just working with a sleep specialist, okay, to figure out which
Mhm.
of these treatments, which we didn't even name them all, but which one is right for you.
Okay. All right, Dion, you are absolutely right. But let's wrap
Mhm.
up this episode now. If you're exhausted all the time, don't just accept it. Get tested.
That's right. When you hear sleep apnea, think low oxygen levels, not just feeling tired. It's underdiagnosed, but it's also incredibly treatable, and treating it can be life-changing.
Yes, we're talking about better sleep, better mood, better focus, and most importantly, protecting your heart and your brain from long-term damage.
Right. So now that you know all this, you're educated on the topic, do something with this information. If you have symptoms, talk to your doctor, tell your parents, your friends, spread awareness. Let people know about this.
Bottom line, sleep apnea is a hidden epidemic. It has serious consequences. Please don't tape your mouth shut. Get a real diagnosis. It just, again, might be the best thing you do for yourself in 2026.
Yes. In fact, yeah, not only are we saying don't tape your mouth shut, we're saying do the exact opposite. We need open airways, okay?
Yes.
And not just opening your airways, open your mouth.
Mhm.
Share this information, like we said again. If you can share this podcast episode, okay, share it with someone. This platform is meant to educate as many people as we can. So please subscribe, leave us a review on our streaming platforms. We love hearing from you, okay?
Absolutely. Until next time, remember, we're just two doctors who don't want you to be duped.
So sleep well, everyone.
Bye.
Bye. Good night.
Good night.